Welcome back to the third lecture of part one. In this lecture, we're going to talk about artificial intelligence and big data. So what is data science? We've seen it before in the previous lectures. Data science can be defined as the set of fundamental principles that support and guide the principled extraction of information and knowledge from data. Oh, that's quite the mouthful. There's also the term data mining that comes into play often when you hear about data science and data mining. And data mining is the extraction of knowledge from data via machine learning algorithms that incorporate data science principles. So data science is the overarching concept of extracting information and knowledge from data. And data science, of course, has been around for many, many years, just like artificial intelligence. But again, it's come to the forefront thanks to compute power, storage, and in this case, the collection of data. So we are collecting more and more and more data because we are in the, communication age, if you wish, with networking. So when we talk about data science, there are three core concepts that make up data science, and you need all three in order for it to be data science. There's the math, of course, because we're dealing with random variables, we're dealing with numeric variables that measure something or count something for frequency. There's the computer science, of course, because it's through computers that we are collecting this data, we're verifying this data, we're validating this data, we're manipulating this data. But lastly, and not least, is the domain expertise. If anything, I'll say it's probably more important than the math and the computer science. And the domain expertise is the knowledge behind the data. So meaning we need to know about the data. It's kind of funny, the data gives us knowledge, but we also need to be knowledgeable about the data in order to work with it. And so that's where domain expertise comes in. If you don't appreciate, understand the data, then you can't work with it, not only efficiently, but correctly. And so the intersections of these three core concepts is where you find what you've probably heard of most. So for instance, just collecting data and knowing about the data and understanding the data is data processing, right? So you need somebody who knows what they're collecting and how to collect it, and they do it through computers, and so that's data processing. If you then, take your data to a statistician and say, hey, can you help me do the analysis so I can infer from this data? That's statistical research. And once again, you need a domain expertise in order to understand what you're going to ask. Like, what questions are you going to ask of the data? What are you going to test? And then, of course, the math, so the statistics, is what actually tests the data. And lastly is the intersect between math and computer science, and that's machine learning, which makes sense because machine learning is a form of modeling algorithms that's going to process or manipulate your data in such a way that you can learn from it. And that's your machine learning. Now, if you do all of this together, so you do the stats, you do the processing, you do the machine learning where you're learning from your data, then this is data science. Okay, so you must be thinking, who is this data scientist to be able to do all that? Well, here's a nice visualization of all the subfields of data science and what it's based on a survey, and there's a book actually published analyzing the analyzers that it came from. And they basically asked a data scientist to describe their skills and how they, self-identify as a data scientist. And what they found was there was basically 4 types of data scientists, and that's in the columns of this figure. And in the rows are the skills, basically. And it's interesting, if you look the four different types, you have a data business person, you have a data creative person, you have a data developer, and you have a data researcher. So let's start with the data researcher, because that's probably the easiest to start with. Inevitably, it's going to be the more classic description of a scientist. And you can see from the skill perspective, that business is one of the smaller components of the data researcher, along with programming. So meaning that this data researcher spends more of their time in statistics, which makes sense, as well as math, as well as a bit less machine learning and big data. And this is what would be described as the data researcher, right? If you then carry on to the left, we have the data developer. And the data developer tends to be a little bit more balanced. And you have, once again, low on business, but then here low on statistics, but higher, much higher in programming and machine learning, which makes sense, and then inevitably math in order to understand the programming and the machine learning. And this is the data developer. So this is more of the engineering type. The data researcher is more of the classic kind of professor. Now the data creative is what I find the most personally I find the most interesting, and once again a little bit more balanced. Maybe even well, no, similar to the data developer. And the data creative, once again, a little bit of business, but lots of machine learning, fair amount of programming, fair amount of statistics, and then some math. So if you compare the data creative and the data developer, you can just see immediately you have a little bit less math in the data creative, and you have a little less programming, but a little bit more statistics. Okay. And finally, you have the data business person. So the data business person is usually, most probably the person that comes with a little bit more content expertise. So they have a lot of business, and that's the content expertise. They have very little programming. They have some statistics, inevitably, because they need to appreciate the numbers in terms of the value for their business. And they have some math and some machine learning, because they also need to understand the machine learning. So this is just an interesting, figure to help you decide or understand who the data scientist is, and what he or she will contribute to, let's say, your research program. Okay, now we've been talking about data a lot, and we've also mentioned the term big data. And so I think at this point, let's address big data. What is big data? So originally, there were the three V's to describe big data, and it was volume, velocity, and variety. So volume is very simply how much data, of course, you have. And if you have a very, 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 very large amount of data, you could potentially consider it big data. Velocity is, what you call data in motion. So meaning like at what, speed are you receiving new data? So consider it almost like a pipeline, right? So how big is your pipe that is sending you this data? And if you're receiving vast amounts of data over time, then this could be considered, again, as big data. Variety is the different forms of data, the different type of data that you're working with. So not necessarily the different variables, but think more the different types of data. So what are you collecting? Are you collecting survey information, measurements? Are you collecting social media type of information? Are you, all of those are different varieties of data that all need to come together in order to tell the story. And so the more different forms of data that you're collecting contributes to the variety, which once again, if you have many, 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 many different types of variety, that would be considered big data. Now, typically, you have a combination of the three in order to really stake your claim in terms of big data, right? So if you have a very large amount that's coming in, very quickly every day, and there's a whole variety of different data types that you're collecting, wow, that's for sure big data. Now what happened is the 3 V's got expanded to the 5 V's, where they introduced veracity and value. So veracity is authenticity of the data. So meaning if you have this challenge of your data, having to authenticate your data, meaning do you need to check to see that whatever you're receiving is actually valid, true, what you expected to receive, because you're not sure about it, then that contributes to the big data problem, because inevitably if you're receiving a lot of data, different types of data, and very quickly, and on top of that you have to check to make sure that the sources of the data is appropriate, that it's not contaminated, that it hasn't been hacked, then that's veracity. And finally, the one that the data scientist, who's more of the data scientist business person, is going to be interested in is the value of your data. So meaning that you may be collecting lots and lots and lots and lots of data, but if there's no value in the data, if it's not going to make, if it's not going to make a difference, it's not going to make a change in what you're doing as a business, then maybe it's not a big data problem. Maybe it's just I've got a lot of data problem and I don't know what to do with it, and most of it's garbage. But if you have, large volumes of data that are, complex and lots of variety, and you have to check it for authenticity, and it's worth a lot to the company, meaning that it's going to make the difference to the bottom line of your company in terms of revenue, then that's the value in the data, and once again that contributes to defining big data. Okay, let me talk to you guys a little bit about an application of big data and machine learning and artificial intelligence. So this is the part where we're bringing them together. So here's an example. So I'm the Chief Science Officer for a company called AceAge. We're a medical device company. We create a medication delivery device, which delivers medication in cellophane pouches to our customers at their home. And the product is called Carry, and our logo is Medicine Made Simple. Okay, so there's the example. Why, first and foremost, do we have this device? So here's the interest in the data, right? And so what we're addressing is a medication adherence problem. People forget to take their medication, and it has a large impact not only on the health of the patients, but also on the healthcare consumption, which means that there are more emergency room visits due to medication problems. There are more nursing home admissions, because if someone is incapable of managing their own medication at home and they're constantly getting sick and having to go to emerge, then that's a reason to be admitted to a nursing home. And so there's the problem that we're trying to address. So by using a device such as Carry, and here's just a picture for you here, you can load the device very simply with the medication strips. It schedules it for you, so it lets you know when your next dose is, when you're supposed to take your medication, and then alarms for you, and you just simply press the button and it delivers it for you, and you get the pouch with all the medications you need when you need it, and there you go. That's a way to manage your medication. Now, what if we could up the ante a little bit on data? So we have this, medication delivery device that is, in someone's home or in their room in a residence. And now we can connect it to, for instance, activity monitors or, vital monitors. So like blood pressure or a glucometer, even SATs or something like that. So, or weigh scale. There's an easy one. Right? So now we've got this communication going, this networking that's going on, and now we're collecting more and more data, right? So we're collecting not only the data for medication adherence, so when they took medication, what medication, all that kind of stuff, but now we're also collecting, daily blood pressure, weight, glucometer readings 3 times a day or whatever, 2 times a day, and then the possibility of activity, how active they are, and we're collecting all this data on a regular basis. So let's assume that 5 million care units are deployed across Canada. This is just a hypothetical, situation. Each patient has a schedule for their 3 or more medications a day. What medications are delivered when, what the medication name is, the drug type, the dosage, the unit of frequency, blah, blah, blah. And we also have the additional medical device data that I just talked about. And let's say, for example, weight scale, glucometer, and blood pressure. Okay, so volume is pretty clear. We're collecting a lot of data from different devices. I mean, interestingly, that's not that many measures, but when you take into account that, data can be sent with every delivery of medication, so that could be 3 to 5 times a day, it adds up, right? So 50 to 100 kilobytes of data per unit per day, let's say. That adds up to 21 gigabytes of data every hour, 500 gigabytes per day, 183,000 gigabytes per year. It just adds up because there's a lot of devices, right? So there's your volume. If you also include, the schedules, like the full schedules of what medication to take, the log data, think about overhead of all of the software systems. The total required storage, let's say per year, is adds up quickly to like 230 terabytes, 213 terabytes. So there's the concept of big data slowly creeping up on you, right? So in terms of volume, the velocity is going to be how many times data is sent to us. And so think of it, if we have 5 million patients, their delivery, that when their medication gets delivered is going to be across time zones. It's going to be all different schedules. And so we're going to be receiving data like all the time, right? And different peaks and valleys in terms of the velocity. And so there's an example for your velocity for big data. So how about the variety? So, easy stuff, schedules and log data, that's easy data. Numeric data for measurements, that tends to be quite easy. Where it gets a little bit more tricky, textual data from questionnaires. So let's say, we have the capability of asking patients questions on the device. How are you feeling today? How did you sleep? Blah, blah, blah. So there's textual data. How about image data, right? So video recognition of medication ingestion, for instance. I didn't take this into account in the sample calculation, but essentially that's another thing. If we wanted to go beyond just adherence, just checking to see if it was delivered, but we wanted to make sure they actually ingested it. Well, we could send video recognition, right? That they actually put it in their mouth, and there's another machine learning, artificial intelligence solution that we could put together. So that's variety. So lots of different types of data coming from different sources, and they have to be processed differently. Okay, the veracity. The veracity is truthfulness or accuracy, right? So how the authenticity as well comes up in veracity. So how are we sure that the data is what it is? In this case, veracity is less of a concern, and we don't deal as much with unstructured data like social media data. So social media data is the unstructured data. It's a challenge to work with, right? But in this case, it's contained. It's a medical device, so it's much easier. But there would be where veracity would come in, is if you wanted to take into account social media, so tweets and Facebook and all that kind of stuff. So the last one is value. So that's a great question. So what is the value of this data that I've just described to you? Well, let's use an example. So 20 to 30% of seniors experience one or more falls each year. And the falls cause 85% of seniors injury-related hospitalization, 95% of all hip fractures, and $2 billion a year in direct healthcare costs, and over 1/3 of seniors are admitted to long-term care following hospitalization for a fall. So the impact of a fall is huge, and everybody, well, not everybody, but many people know this, and there's a lot of research in this area in order to prevent falls. So what causes, these falls, right? So very often it's acute illness, that makes sense. Balance or gait deficits as you age, sadly, that is something that comes on. Chronic conditions and disabilities, which sadly, once again, is often associated with the aging population. Cognitive impairments, low vision, muscle weakness, and reduced physical fitness. All of these contribute to the risk of falling. There are also behavioral risk factors. So what do I mean by behavioral risk factors? So you can have assistive devices, right? If you have assistive devices, then chances are you're going to be more unstable and you could fall. Excessive alcohol, of course. So if you drink excessive alcohol, then chances of you falling over is greater. Fear of falling. Footwear and clothing. So if you're wearing the wrong footwear, my mom is she's terrible for this. She loves wearing sandals, open-toed sandals, but at her age and with her gait, it's a challenge because she catches her sandals on the sidewalks and stuff like that. So there's an example. History of previous falls is associated with future falls. Inadequate diet, so you're feeling a little dizzy because you didn't eat enough that day. Inevitably medications. There are many medications that contribute to it. Risk-taking behavior, even vitamin D, which is associated with risk factors. So what's the evidence? Systematic reviews of the evidence have shown that there's a strong association between falls and fractures in older people and the use of certain medications. So that's not surprising. That's very often medications can make you a little bit dizzy, or unstable. Basically, you lose your balance. Now, older adults taking more than 3 to 4 medications seem to be at a higher risk of falls. No surprise there. And furthermore, complications related to diabetes, such as neuropathy, retinopathy, and nephropathy, likely contribute to an increased risk of falls. Just a quick plug for diabetes. 29% of Canadians are living with pre-diabetes, and diabetes is associated with just so many chronic illnesses that it's definitely something to consider. And in this example, the diabetes is associated basically with falls. Okay, so all of this to say, what if we could prevent falls? That'd be a big deal, right? We've just seen how the impact. So with a big data AI solution in place, we could predict when a patient is at increased risk of falls and notify them, right? So put in place appropriate measures for prevention, an at-home monitoring system, for example. So you're thinking, well, okay, why would we do this? Well, this medical device that started off on its own and then connected to other devices, and we started collecting all this data, and it's real-time data, and we learn from this data, and what we're going to do is we're going to learn all the different conditions, scenarios, patterns, whatever you wish to call it, in terms of when a person is at risk of falling. So a combination of medications, the combination of throw in their blood pressure, throw in the possibility of weight loss, glucometer readings, so where's their sugar levels. All of this put together can contribute to the ability to predict a fall and say, hey, you're at risk. And what can we do then? We can actually notify the patient directly, either through the device or through the app. There's an associated app. And so there's the value of the big data, the value of your data, and using artificial intelligence in order to learn from that data. So hopefully that gave you a good example of how you transition through the 5 V's of big data and determining whether you have a big data problem, and ultimately also trying to see, is there a value in working with this data? And that's what I was trying to help you guys see, is that that piece of value is critical for business, for industry. It's often missed in the world of academic research, where it's almost seen as taboo, like, ooh, we don't want to talk about value in that sense, because then maybe we're talking about profit or we're talking about money. And that's true. But you also need to think about the value to the patient, right? Which it could be quality of life, right? It could also be saving the government money, right? So reduced healthcare consumption is a good thing, and that's a dollar thing, right? So don't be too quick to say, oh, I'm not going to talk about the value. I just want to do the research. You should include the value in your research because it helps you find motivation and drive in order to be successful in your research because you're going to be contributing back, let's say, to the healthcare system. So what now? Where is AI used, right? So here's just like a list, literally a shopping list of all the different areas that AI is being used currently, and it's much longer than this, but this is just an interesting, compilation of them. I love the chatbot one, or virtual assistant, right? Many people probably don't realize that when they're doing the little chatbot online because they need help, there's no person behind that. It's actually AI, and it's getting so good that you can't really tell. The difference between just canned responses to actually now chatting with you. It's amazing. That's just one of the many. But the other one, of course, is self-driving cars. Wow, that's going to be a great one, right? And the one that obviously is important to us, especially in this class, is healthcare and medical imaging analysis, right? Which is just huge, and that's what I spend my career doing. So this brings us to AI in medicine. So addressing high medical and medication error rates, as well as high cost and low productivity, probably sums it up. I think that is what we're looking to artificial intelligence to help us with. Okay, low-hanging fruit. AI for medical diagnosis. I mean, this is something that people think of immediately. Can we improve diagnosis of disease? So inevitably, there are so many projects out there currently that are addressing this issue, looking at ways to improve diagnosis of disease. The interesting, aspect of this is that it's probably also the hardest in order to be successful because, making diagnosis means you're replacing a health professional, and that's a big deal. Especially from a regulatory standpoint, you need to be sure that whatever software you've put together is going to do a good job and is going to be accurate and is going to be consistently accurate, let alone better than the health professional that you're hoping to replace. And so you can imagine it's going to take much longer. It's going to be much more stringent, much more difficult in order to get this software approved, from a regulatory standpoint, to be used in clinic. And that's the reason that we have not seen yet any obvious software that's actually doing that. That's just making diagnosis and has essentially replaced a health professional. It's coming, but it's not there yet. So when thinking about computer-aided diagnosis, it's also important to think about what jurisdiction you are using CAD in for your medical practice. Whenever you are providing solutions to problems, determining or describing the jurisdiction that you're going to apply your solution in is important. And the reason for that is because there are different wants and needs in the different jurisdictions. So here's an example, a paper that was published in 2018 by Love et al. And it shows that combining CAD with low-cost ultrasound improves the accuracy of identifying palpable breast lumps. So of course this is important anywhere for any screening process, but in this case, one of the challenges is being able to aid minimally trained operators, because in this jurisdiction, that's one of the challenges they have. And so, and this is in Mexico, for instance. And so this is just an example of how, the strength, the advantage of applying artificial intelligence, machine learning, CAD to a problem is increased in a different jurisdiction, and in this case, in what's termed a third world country or a less developed country. Okay, how about AI for prognosis? I mean, basically collecting information, organizing it to provide insights in order to improve clinical decision making. This is right now a sweet spot for artificial intelligence. And, like triage, prioritizing, efficiencies. This is very helpful for the clinical setting. It's also very helpful for, healthcare consumption. And inevitably, it has an impact on patient care as well, because it enables the system to focus on where it needs to focus at a given moment in order to address the most urgent cases and issues. So here's an example of using CAD, or artificial intelligence, in disease prognosis. CAD can be either computer-aided diagnosis or computer-aided detection, and we'll go over that later on in the course as well. But in this example, this article by Wang et al., they looked at using 2D hand photographs in order to predict or to assess the likelihood of postoperative remission in acromegaly. So acromegaly is when you have an excessive amount of growth hormone being produced, and it never stops. And an example of that is the world's largest man in Niagara Falls. And I don't know if you've been on Cliff Hill, but there's a big statue of him. And anyway, that's acromegaly. So in this case, it's a simple solution of using pictures of their hands in order to be able to prognosticate or give the prognosis for postoperative remission in acromegaly. And so this is what is the hopes for artificial intelligence and machine learning algorithms, is to provide these simple and easily implemented solutions. Now, treatment is a big one. So precision medicine definitely is on everyone's mind these days. And to allow doctors to recommend better treatments for patients through the help of data is huge, right? Because being able to know when and how to treat is so important, because the population is heterogeneous. If everyone was the same, if there was no variability in the data, I wouldn't have a job, for instance, because I'm a statistician. So that would be the first big bummer. But from a standpoint of medicine, it'd be easy, right? Because everyone's the same, so you know exactly if this treatment works for one person, it's going to work for everybody because everyone's the same. But as you know, that's not the case, and that's what brings us to what was originally personalized medicine and is now precision medicine. Nice segue, of course, into what is precision medicine. So if you're wondering, it's the ambition of precision medicine is to design and optimize the pathway for diagnosis, therapeutic intervention, and prognosis by using large multi-dimensional biological data sets that capture individual variability in genes, function, and environment. And so this just sounds like an absolute perfect fit for artificial intelligence, just based on the two previous lectures that you've had so far. So where are we at? What's being used in medicine now? So here's an example of a study that was performed in order to compare three deep learning systems that were put together for detecting TB-associated abnormalities in chest X-rays, and this was tested on outpatients in Nepal and Cameroon. So, why am I bringing this one up? Well, this is kind of the sweet spot once again for AI in its early stages, and that is to put together algorithms or AI solutions that are going to be able to perform a task which maybe here is not needed, but is needed in specific areas. So namely underdeveloped countries where they don't have access to the healthcare we have. And so there's a good application for this AI, and that is because they don't have access to the healthcare professionals that we have here. And so the risk of replacing a healthcare, professional, which is, here is frowned upon. Well, in countries that don't have access to those healthcare professionals, then these AI solutions will be very welcomed. And so it's interesting that this is probably where a lot of the validation of these algorithms is going to occur as well, and is going to provide the building blocks for future AI solutions that are going to be even better and do even more. Another interesting application is, Meadow AI has received FDA approval to automatically detect hip dysplasia, which is, associated with early hip osteoarthritis and hip replacement surgery. And so this is, Meadow AI works with ultrasound, a lot of ultrasound. And this is an interesting, solution where it's going to be silent, right? It's going to be just something that automatically is done in order to prevent something negative in the future. So let's carry on with ultrasound. So another company called Butterfly Network has also leveraged ultrasound and basically trying to create the new stethoscope, right? A window into the human body for less than $2,000, by using a portable ultrasound that can plug into your cell phone. Now they use, once again, just like Meadow, they use deep learning based artificial intelligence applications that they couple with their hardware in order to assist the clinician. But you can imagine what they're hoping to do eventually is to make this, or transition this to what's called digital health, where they'll be able to send patients home with this technology, where they'll be able to just, patients would be able to use it themselves and then connect to the healthcare system if something comes up or whatnot. That's digital health. And that's what they're hoping for. That's going to take, quite a long time for it to be approved from a regulatory standpoint. You can imagine you can't just send people home with a device, an ultrasound and say, okay, there you go. You can scan yourself. I mean, there has to be some checks and balances, and there has to be some guidelines and approved guidelines and how to do this. And that's going to take, probably many years, but that's what they're working towards. Okay, let's move on to urology for prostate cancer diagnosis. So they've, there's been a lot of advances in prostate using AI. Just Google it. There's lots of interesting stuff going on. A patch-based deep learning convolutional neural network model has been put together and proposed to classify prostate cancer and non-cancer. From multi-parametric MR images. This is an interesting one, and I suspect that along with breast cancer, the two of these are going to, be probably some of the first AI products on the market for screening, right? So for breast cancer and for prostate cancer. Let me just finish off here with another interesting application of artificial intelligence in the medical research world. So as many of you know, most probably, ALS is a devastating neurodegenerative disease with no effective treatments. One of the interesting areas in the study of ALS is the numerous RNA binding proteins that have been shown to be altered in this disease. So an interesting application, and actually IBM has been doing this for years now, is the use of their artificial intelligent entity, I guess, that they've named Watson. And they've used it to go through all the RNA binding proteins in the genome to identify new ones that are linked to ALS. So you can imagine the compute power that is required in order to go through that is immense. And so to have the ability to perform that type of a task in a reasonably short amount of time with relative ease and to have fairly accurate results come back is amazing. And so that's another application of AI that people may not think of, is that just the ability to sift through vast amounts of data, which once again is a big data problem because you have not only a large volume of data, but you have many, many different types of data. Because you can imagine if you're going through, for instance, published literature, you're going to have the easy stuff, which is the more recent stuff, but then you could also have, many of the publications that are in formats that are not digital, meaning that they're images as opposed to textual, for instance, or they're difficult to retrieve, or they're in formats that are not the same, or they're broken up into different bits, and because of that they have to be parsed in a certain way. So you can imagine that is not an easy task, and if you were to do it manually, or if you were to do it with a group of computers and stuff like that, it would take forever. Whereas, by using, artificial intelligence and machine learning, you can streamline the process, you can speed up the process, and then you can actually get better results from your search. So there's just another example of how, AI can be used in medical research. So by all means, don't think that that was comprehensive. It's not even close. I just brought up a few examples just to give you some insight as to what it's being used for, to give you an idea of the different ways you can apply for it. And what I hope is that we will talk about this in our discussion session. So this is just like a little bit of a primer to get you guys going. Anyway, that brings us to the end of the third lecture, which is the end of part 1. And in part 2, we're going to talk about how AI can help in medical research.